Good morning, my name is Ian Murray and I'm a flight nurse paramedic with Mississippi Air Rescue 5.
My name is Tyler Keys, I'm a flight nurse with Mississippi Air Rescue 5.
And today we're with Harrison County Fire Rescue and we're talking about pelvic slings. We're talking about how we're applying them and what the signs and symptoms are. And this is just a lot of education that we've been doing over the years and just a lot of community involvement with Harrison County Fire Rescue. So when we're talking about pre-hospital care, this is just a very, it's another tool in the toolbox and innovative equipment that's come out as far as pelvic care and making sure that we are getting our patients taken care of appropriately. Today we've talked about the signs and symptoms, how to apply them, and this is just something that, that we're going to go ahead and apply. So it's just a good partnership with our community and with our Harrison County Fire Rescue Service and our partners to make sure that the patient is getting the essential care that they need. We use it quite often in the field on these suspected high injuries that have high suspicion of pelvic involvement. We have a lot of motor vehicle collisions that patients are involved in. We have a lot of flight nurses that come over here from float teams and they can't imagine the amount of trauma that we work here in Harrison County. And the adjoining counties as well. We're probably up there. We're the top 10 in Mississippi Air Rescue, in Metrans as far as traumatic injuries and the amount of trauma that we fly. So these are used quite often in the field. We go ahead and place them, so I think it was a good idea. We were reached out to by Harrison County Fire Rescue to come in here and do an in-service and place, and I'm glad that they're getting these put on their trucks and being very proactive with their trauma care.
And historically, these are highly useful but highly underused, which is why we're doing the education on them. You should place a pelvic sling anytime you have a suspicion for a pelvic injury. It's not going to hurt to place them if they don't have a pelvic injury, and it's certainly not going to help them if it's not placed and they do have a pelvic injury. So anytime that there's a suspicion for a pelvic injury, place a pelvic binder. So you're going to find their greater trochanter, so feel for their iliac crest, go down till you feel their greater trochanters, and then this is still a little high, so I would work it down. This comes over, and again, this is if you're by yourself, so you pull in opposite directions. It pops, and then you Velcro it down to hold itself. And it's okay if you hear a double click, and even on the Sam Medical, it tells you that because then you have it Velcroed in place on. So, right or wrong, Ian prefers to come from the top down. Sometimes it's just wherever you can get to it easiest. Two-person, you move them as minimal as possible. Hold these legs right here. Pull it back. I'll show them how it's done. So have somebody help you hold, and then you're gonna pull it back and forth till you get it where it needs to be. There we go. You're gonna put your fingers through there. He's gonna have that side. And then you're gonna seesaw it back and forth. You're gonna have to do some upward pressure. Okay. So you'll find his iliac crest here. And on a real person, you'll feel their iliac crest. It'll be fatty, fatty, fatty bone. And it's actually really good on this mannequin. Yep.
Say,
One of the best.
what you do. Try your long
Places
rod
right there and under the knees because it's got a little bend to it.
Pelvic binder will have
Do
like,
y'all carry TXM?
Flip it over.
yes.
What's your protocol?
1 or 2 grams. Dude,
How about for pediatrics?
I don't even think we have that in our program. But,
National Registry says.
You can feel kind of where a bone would be though on that dude.
Yeah, well, that's what my drug card said. I don't have it on me. I haven't written that one yet.
So pediatrics, maybe y'all get it. It's 15 milligrams per kilogram.
No, come back off the TV. Look at there. There we go.
But I just learned how.
I would get this probably
A little bit lower?
Yeah. So you want to right over their jump almost. Yours looks fine. He just got to get his side.
Like that.
Yeah, I'll bring my mic up a little bit.
Right.
Yeah, you could almost feel where that